These visit caps that insurance companies keep placing on their health plans, they're crippling people's health. And we're having more and more stories coming out that shows that they're limiting the access to health care that people need, so much so that even when someone's in the middle of a treatment plan, their care is being cut off. CBS News just released a story about a woman who was hit by a car that jumped a curb. And she had a collapsed lung, broken legs, unable to walk, extraordinary amounts of pain, as you can imagine. And despite having paid already $1,500 out of pocket for physical therapy, once she hit her visit cap, that was it. Didn't matter how much she pleaded with the insurance company, and no matter how much medical necessity was shown by medical doctors, physical therapists, everybody, that was it. No more coverage. And this highlights yet another massive issue with the way that current insurance plans and the current insurance landscape of the United States is set up. You can see here for health plans under the Affordable Care Act how many of them have visit caps on physical therapy. That almost 4 out of 5 plans have a visit cap, some of them as low as 20 visits. And while you even see some that might be upwards of 60 or 120 or even no limit, a lot of them have prior authorizations. And those authorizations delay care. A provider, physical therapist sends in their request, and then they have to wait to get that authorization. Usually a few days, sometimes even longer. And then that visit number that's authorized isn't the full amount in the visit cap. It's going to be little chunks. Here's 4, 8, 12 visits at a time. And every time they run through those, they have to get more authorization. And sometimes somebody at the insurance company decides, that's not medically necessary enough, even though your healthcare provider who went to school and got training for it says it is. So we're going to go ahead and cut you off, even if you haven't hit your cap yet. The current way that it's set up with insurance companies takes too much power out of providers' hands and puts too much in these payers' hands, and ultimately, it harms the patient. And this is why I'm a big advocate for direct care treatment plans, whether it be direct to consumer, cash pay, but that's not scalable, or if it's direct to a self-insured employer. So a self-insured employer contracts directly with a provider to cover benefits and cut insurance out. But we also need to keep fighting against insurance companies to get these changes. So keep contacting your legislators, reaching out, making sure to fight for getting better health coverage to improve the health of Americans.